Hey besties, I would like you guys to watch this video. Chinonso Egemba, a popular Nigerian doctor known as Roko Doctor, has taken to his social media handle to make some expose about the healthcare challenge that women face, especially women that are giving birth, pregnant women. Okay, now watch this video. Then when I come back, we'll talk about it.
Give birth. That's the toilet. This is where people give birth. In this primary healthcare center, this is the only forceps in this entire place. They don't have more than this. When women come at night to give birth and there's no light in the hospital, how do you take their deliveries?
Well, you're just using our phone, torchlight.
You're using the torchlight of your phone to take the deliveries. What if there's bleeding? How do you know where it's bleeding? Have you seen the problem that we're facing in this country? That is the electricity that is powering this entire hospital. If your leader is not serious about the primary healthcare center, they are wasting their time. Because the primary healthcare center is the first level of healthcare in any country, any state, any local government that is serious about healthcare. This hospital does not even have adequate solar care. There's no lights. There are women who give birth in these hospitals. You can see what the labor room looks like. There are people who are going to need wound care. You can see what the wards look like. There are children who require help from this hospital. You can see what the resources look like. Vaccines have to be imported from another hospital just so that they can be given to the people here. But no worry, you can scroll because this is not bomb or funny or whatever it is. Tell your leaders that they should focus on primary healthcare centers and not be building fake ultra-modern hospitals everywhere when this is neglected, because everybody everywhere actually deserves access to the highest quality care possible.
I believe you saw that video, the maternity healthcare crisis in Nigeria. It's quite appalling because this is what every mother deserves. Every mother deserves safe delivery and quality care for their children. But for countless Nigerian women, pregnancy is kind of a journey that is filled with fear, a lot of uncertainty. You don't even know the outcome. You don't know if you're going to meet heart doctors or heart nurses or heart midwife that will even make the process long for you. Then in rural area, maternity clinic often lack these basic amenities. Look at what Chinonso Egemba exposed on his handle. Clean delivery room. There's no clean room for delivery. These are the essential things. These are the core things our leaders should look into. This condition is so appalling. Like, how can you deliver baby without proper equipment or electricity? Sometimes people rely on their phone during nighttime emergency. Like, it's so appalling. Like, I can't even imagine. We are not even asking for too much access to healthcare amenities. I mean, what if complication happen? What if complication happen? You guys will hear a lot of Nigerians giving birth to children with a lot of medical condition that should have been averted if they have proper equipment. Many women face this risk on a daily basis, and the outcome is tragic. Nigeria has one of the highest maternity mortality rates in Nigeria, and our leaders are not doing anything about it. Okay, let's assume that you even go to the city, the so-called city hospitals. The situation is not even better there because so many people, a lot of brain are migrating, leaving the country to its appalling state. Overcrowded hospital and overworked staff. Most women that give birth to such condition end up with a lot of medical condition that they can't trace where it's coming from. Don't even have adequate place they will sterilize those medical equipment. What they use for A is what they will use for B, and you wonder why disease, contamination, infection are increasing on a daily basis. I mean, that video is not welcoming. The clinic is overwhelming. There was no doctor in sight. I didn't see any doctor there. Only one overworked nurse trying to cater for dozens of pregnant women. Some must have even traveled a mile to get there, only for them to discover that there's no basic amenities. Electricity is unreliable, forcing midwives to deliver babies by flashlight. Who does that? Essential medicine and equipment like glove, antiseptics, they are not even there. Infections are common. What if complications become fatal? They will lose mother and child. Oh, in many hospitals, maternity care is not free. Seriously, it is not free, and it's not every families that can afford the fees, which is why those families that can't afford the fees, they will turn you back. They will force you to seek help somewhere. I know you must be wondering, oh, must they go there to give birth? What would they do? Without access to affordable health care, many women rely on this primary health care to give birth to their children. You can't even post about it in the urban areas because most urban hospitals they are overstaffed, overworked. Women in labor wait for hours, sometimes days without receiving attention because almost everybody is having one backlash or the other. Why making the process that is already painful to this woman? I mean, giving birth is not a child play. Instead of you to provide access, provide good medical equipment to cushion this pain, they have their babies in a serene environment or in an environment that they will relax. But no, Nigeria has one of the highest mortality rates in the world. Every day, women are losing their life to something that is preventable. Complications like excess bleeding, infection, prolonged labor, and all that should have been averted if this government did what they are supposed to do. For every 1,000 live birth, approximately 512 Nigerian women died, which is on a higher level. These numbers are more than what the statistics are showing. Of course, there are some hospitals that don't keep record that statistics can't even get to. I understand that in some areas progress is being made. NGOs and local initiatives are stepping in to build maternity ward, kind of providing training for midwife, offering free medical prenatal care, but that's not enough. How many can they cater for? Education and access to all these things, all these resources that are saving life are a huge problem in Nigeria, and it requires national and global action. It's not something that everybody will see and keep quiet. I just looked at that video and I'm weeping for all those women. And this is me saying to every Nigerian women out there who survive. There are many who don't. This hard condition Nigerian women face during pregnancy and childbirth demand our attention. No one should lose their life bringing life into this world. No, nobody deserves that. Nobody deserves that. Please let me know what you guys think about this video in the comment section. Share this video to people that are in charge. Let them do the needful. Thank you so much for watching. Please don't forget to like, don't forget to share, don't forget to subscribe to this channel. I'll see you guys in my next video. Bye guys.